The second most common acrylic adjustment usually occurs with expansion appliances, such as the one you see here. This type of appliance is made so as to have intimate contact with the palate. It follows the shape of the patient's palate, so obviously every arch is going to be a little different. When we're using an expansion appliance, one of the things we're looking to accomplish besides lateral development of the occlusion is development of the arch itself. This usually results in a dropping of a high vaulted palate. As you can see, this particular appliance has been made for someone who did have a high vaulted palate. Note that as you turn the screw, it's important to adjust the acrylic along the palatal area. This is necessary because as the screw is turned, the pressure of this appliance will cause the patient's palate to drop. If you do not adjust the palatal surface of the appliance simply will not fit after a period of time. The patient will either stop wearing it or come in and tell you that the appliance is dropping out of their mouth. So as you adjust the expansion screw, it will be necessary to adjust the palatal surface of the appliance. On the day of delivery, you may note some areas of the appliance that need to be adjusted for patient comfort. Our goal is to make this appliance fit as intimately to the palate as we can without any sharp high spots hurting the patient. One of the best techniques to check for high spots on any of your appliances is to use a pressure indicating paste. You probably remember that the regular pressure indicating paste that most of us were taught to use in school is rather messy. One of the products we recommend is this Coltine pressure indicating paste. It's a material that comes in a two-paste system, as you see here. When mixed together, you can place it on your appliance and then place it into the patient's mouth, after which you push it up against their palate or against their lower arch. Once set, remove the appliance from the patient's mouth and you will see the high spots as they will have perforated through the material. It shows you very clearly where you need to adjust your appliance. Once the high spots have been identified, use a pencil or arch marker to mark them clearly, after which you peel away the hardened indicator paste. You then use a burr to grind off the high points and smooth the acrylic and then check the fit in the patient's mouth. As this appliance is expanded and the palate drops, often it will stop the appliance from seating properly. One of the best ways to check the area is to use pressure indicating paste as was just shown. For purposes of showing you what we will normally see, we've marked the areas that have perforated through the pressure indicating paste with a wax pencil. Basically what needs to be done is to adjust the thinnest layer of acrylic there and do it slowly so as to make sure you can get this back into the patient's mouth and yet still keep intimate contact with the palate. You can see the difference between the adjusted side and the original side. Once you're satisfied with the adjustment, you can then take it to the polishing machine and smooth it for patient comfort.